There's a couple of different modalities that we use in imaging to look at the heart. We have echocardiography, which is kind of like a sonogram or an ultrasound. We use that to determine if there's any problems with the motion or the squeezing of the heart, as well as to look at the valves to see if they're opening appropriately or if there's any leakage in the valves. We'll also use things like SPECT or PET in order to evaluate if there's any problems in the metabolism of the heart, or to see if someone had or is at risk of having a heart attack. One of the newer modalities that we have is called cardiac CT, and we can use that both to look to see if there's any blockages directly in the heart, but we can also use it to see if there's any blood clots that could be in the heart that could prevent someone from getting something like a cardioversion or an ablation for their AFib. The thing that's really neat about cardiac CT is that it gives us a direct look. Most of the other ways that we have of looking at the heart in the form of stress tests, we're kind of inferring what's going on. We have a general idea that there's a risk of a heart attack, there's a old heart attack that happened. Whereas with a cardiac CT, we can go in, look inside the vessel and be able to determine, okay, there is calcium in the vessel and there's this much, and that is a surefire way of knowing that we have a heart attack. It's like having a cardiac cath without having to go through all the rigmarole of getting the IV in the leg or having to sit underneath the camera for an hour. And the test only takes about 5 minutes, so it's really a beautiful test. So for the patient, there's 2, maybe 3 big differences that come up. One, they're gonna be receiving a medicine called metoprolol and another one named nitroglycerin. These ones will slow the heart rate down and open up the blood vessels around the heart so that we can see as clear of a picture inside of their heart as possible. And we're also attaching EKG leads in order to track the beating of the heart so that we can make sure that we're imaging their heart at just the right moment so that we can get the clearest and most pristine images. Sometimes they'll just be looking for one quick frame, and with that, sometimes the patient moves through the scanner rather fast, but that gives us a very clear picture of what's going on at that one moment in time. Sometimes though, we'll take an extended number of pictures in order to evaluate if one of the heart valves is opening and closing appropriately, or even just to look at the pumping function of the heart as well. So cardiac CT, there's a number of different ways in order to do the scans, and it's one of the more unique and involved methods of evaluating the heart. Traditional stress testing will give you an idea of your risk at that moment in time. Versus cardiac CT, because of the way that the technology is advanced and the literature is advanced, if you have a calcium score of 0, then you have less than 1% chance of having a heart attack each year for the next 5 years. So if you have some calcium, that obviously increases your risk, but if you've got a 0, that's a very different thing. And that's a very large peace of mind that a lot of people will have for the next 5 years if they have that 0. One of the other things that I do in my job is cardiac MRIs. And cardiac MRIs are really a fascinating study that we do. We often do them for things like evaluating cardiomyopathy or heart failure, or after someone's had a heart attack to determine if they should have a stent. Most of the time, an interventional cardiologist can determine if someone needs a stent on their own, but sometimes they'll have an extra question of whether or not it's the right choice in terms of treating the patient. We also use this to determine if patients have a whole host of different diseases, like amyloid or hypertrophic cardiomyopathy, or if they have holes in their heart, or even if they have more rare genetic conditions, or if they've had a virus that's affected their heart. One of the unique things about MRI that is really appealing to me is that because of the way that the magnets will affect the water in your body, you'll get these beautiful looking images that will really kind of look like artwork in many cases. So it was one of the other things that really appealed to me when I was thinking about specializing and led me to specialize in cardiac imaging.